Recording. Welcome everybody. Just go over a couple of housekeeping things here. Most of you will look familiar on the Zoom spaces, so you know how to do the Zoom. Please, make sure that you stay muted so we don't have the background noise. Here is our COVID recommendations guidance. I hope that it's not impacting your programs lately. I know it's getting towards that time of year where people are sometimes get sicker. So we want to make sure that if you are here and present on camera today, then you will get credit. We are recording it, so if you're watching the recording, you will not get training credit, but you can totally get the information, which is going to be a lot of good information. When you're not speaking, if you could keep yourself on mute so we can not have a bunch of background noise, that would be good. If you could raise your hand or put your question in the chat box, we sure would appreciate it. And at the end of the class, we'll do an evaluation. That way you can get your certificates.
Thank you, Jessica.
Hey, can you guys hear us?
We can.
Yeah.
So sorry, quick question. I don't know why it got me in safe driving mode and I cannot see the screen anymore.
Okay.
Can
Go
I
ahead and
leave?
swipe. Go ahead and try swiping on your phone to the left.
Oh, there it is. Oh my goodness.
There you are. Yeah.
Oh no. Okay, let me mute. Sorry.
Also, if there's more than one person, if you could please put your names in the chat so we know if you're sharing a device. That way we could get everybody credit. That's really important.
All right. Well, now we're going to get everybody credit because they're going to get their names in the chat and they're sharing screens. So everybody's here and everybody can see. So our objectives for tonight are to learn about the Municipality of Anchorage Health and Wellness grant opportunities and how to apply. Probably should have said this at the top, but a lot of the things that we're going to talk about tonight are only available for people who are working in programs licensed by the Municipality of Anchorage. So we have a grant from the Municipality of Anchorage, so we can only serve those programs and people working in those programs for many of the opportunities we're going to talk about tonight. We'll also talk about some general thread services that would be applicable to programs and employees inside the Municipality of Anchorage, and then also who are licensed by CCPO around the rest of the state. So for the three things that there's three different types of funding right now that Thread has through the Municipality of Anchorage. So we have had for the last year or so a technical assistance grant where we can provide some technical assistance to programs with their applications to seek funding. So many of you were probably recipients of that when you were applying for the different COVID stabilization funding. And we had to call and ask you to send your W-9 or sign your application if it came through unsigned. So that is what that service was about. Part of phase 3 COVID stabilization funding was some location-based funding. So that was money that the Municipality of Anchorage gave to Thread to send to programs as part of phase 3 stabilization programs that were in the Municipality of Anchorage. And that was location-based. So you had to be in the Municipality of Anchorage, programs did. And the funding was based on their license capacity. So most programs have already received that funding. We do have an application open right now for those who did not receive that funding as part of phase 3. The third piece of work that we're doing with the municipality is what we're here to talk about tonight, which is a health and wellness grant that we received as a result of the passing of Prop 14 in our last municipal election. And it is funding that's coming from the alcohol tax, and that's coming to Thread to provide health and wellness opportunities for educators and programs within the municipality of Anchorage. So we're very excited to have you all join us tonight and hear about what those opportunities are. So I'm just going to give you a little bit of an overview of THREAD. So many of you who've taken our trainings are familiar with this slide. This is our vision that all early care and learning is accessible, affordable, high quality to support positive outcomes for children and families. And that our mission is to advance the quality of early education and child development by empowering parents, educating childcare professionals, and collaborating with our communities. So this is a nice educating childcare professionals and collaborating with our communities, because these opportunities are funded from the municipality of Anchorage. And then our core values are empowerment, access, children's rights, childcare professionalism, and innovation. So now we're going to talk about the current opportunities. So right now we have an application that's open, and there's 3 different things within that application that you can apply for. There's some wellness training that we're going to talk about. There is getting access to a United Way Health Navigator. And then there's our Ally Health telehealth information. So you're going to hear about those 3 next. So our wellness training, we have contracted with Woodry Birch, who many of you may have taken training with before. Wellness training, and she's providing deep support, how self-care and boundaries foster resilience. There are 2 opportunities to take that training. So there's one on September 12th and there's one on October 11th. Woodry is also offering, as part of that training, some post-training group sessions that will be available. And then there will be a $60 stipend for those who attend the training. And now I'm going to turn it over to Jessica to talk about United Way Healthcare Navigators.
Okay, thank you, Jen. So the United Way Healthcare Navigators are these healthcare experts that you can access if you work here in the municipality. You just have to sign up as part of the application and select that you want to be contacted by one of these health navigators. And they are there to help you do some TA and identify the right healthcare plan for you and your family. They can help you renew your current plan. They can give you assistance with applications. They can also help with Medicaid and Denali Kid Care enrollment. And they really are funded by the federal government grant funds and have the time to be able to answer questions for you and, define insurance terms for you, kind of give you like a mini insurance information, and then help you find that right plan for you and sign up for it. Through the healthcare marketplace, where you can identify those plans that are out there in Alaska, they will help shop for what is best for you and get you signed up. And they provide an opinion where they're not biased. They're not trying to, sell you some sort of insurance because they're going to make a commission. It's just they're federally funded, and so they're there to help you. And so healthcare can be one of those things where there's a lot of questions and terms and acronyms. So I really encourage you to use that resource and have those healthcare navigators give you a call.
Great, thanks, Jessica. And now we're going to turn it over to Brandon with Ally Health to talk about probably the most exciting part of this whole thing, which is the telehealth services that THREAD is making available for free to 500 educators within the municipality.
Perfect, thank you. I'm just going to share my screen here real quick, get my presentation up for you guys so we can dive right into all the things telehealth and talk a little bit about what that's going to mean for the educators there. Obviously, a very exciting new program to be launching here in Alaska. I'm super excited. I've never been to Alaska, so maybe this will be a reason for me now to make my way there. So I am Brandon DeCesar. My company is actually Optima Benefits and Payroll. I do work with Ally Health, but I'm kind of a consultant, if you will, and I've worked with many childcare providers across the country in bringing telemedicine and teletherapy through a lot of early childhood and educators. So this is a fantastic program that really fits well within the space that you guys are in. So it's really exciting to have this available. Obviously, everybody that is eligible, there's no cost. So that right there is a huge thing that this has been handled through the grants. So it's just overall really convenient, great program. So I'm just going to kind of get into some of the main nuts and bolts of it. So basically what you have is 24/7 access to a physician for your everyday ailments, sicknesses, things that come up throughout the day that allow you to essentially call and speak to a licensed physician anywhere that you are in the country. Obviously, most of the time, I'm sure you'll be using it in Alaska. But if you are traveling ever, it's so convenient as opposed to having to go to an urgent care or an emergency room or things of that nature to where, you're kind of out of your element and you might have something, small. You might have, poison ivy, or you might have, a sinus infection or bronchitis. So your everyday items, you can call a physician that they can then prescribe medicine if they deem that necessary. You can then select the pharmacy of your choice that they would call in to the pharmacy to provide that prescription. So overall, just provides like a lot of time savings, efficiencies. Doesn't have to, it's a very quick process. There's multiple ways in which you can access the care. So really anything that you could think of to where you can almost self-diagnose yourself, or you have a pretty good understanding as to what's going on within your own, situation, that you can speak to a physician over the phone. You can do video calls. So there's a lot of ways in which you can get treated. You can take pictures and upload them. So there's just a lot of options that give you kind of that ease of care when you need it. So obviously here on this slide, you can see all the different items that are there. But again, anything that you can essentially avoid going to the urgent care, going to the ER for, even sometimes making an appointment with your own physician can take, many hours to be able to be seen. So just a super convenient way for you to kind of get a new way of getting care. And this has no bearing on your current health plans. So this has no interference whatsoever. If you're on a group plan now, if you're on Medicaid, or you're on a marketplace plan, there is no interference. There's no issues there with having this coverage as well. So as I mentioned, obviously you're going to speak to a state licensed physician, so that's important. So when we call in or when you set up your appointment, they're going to ask you, where are you at the time? They probably do have some sort of tracking on you to be able to know that what state that you're in, because it's important that you are speaking to a state licensed physician. It's an average of 15 years of practice experience. A lot of these doctors are essentially doing this on some downtime. So these are mostly doctors that have their own practices that kind of space out a couple hours throughout their day to start fielding calls that we would have through our service. We have over 3,000 physicians, multilingual. So essentially any language you should have access to. They'll either have some sort of translation service that's available to you as part of the program, or obviously there might be Spanish speaking, or some more typical languages available without any other additional items needed. The other great thing, of course, with this is that our average wait time right now to speak with a physician is only 6 minutes. So just to be able to have that peace of mind to talk to somebody when you have issues, whether it's with yourself or your children, having a 6-minute wait to actually speak to a physician about what's going on. And sometimes they might say, that's something that you may want to go to the emergency room for. But at least you'll have that soundboard to that person, to that physician, to be able to speak to them about your symptoms and what you have going on. And of course, you guys have unlimited calls. So there is no limit to the amount of times you guys can use this program. And of course, it does cover everybody in your family as well. So, not only are you as the employees covered, but everybody that is in your family is also eligible for this service, completely free to you. So certainly a great program with a lot of different perks. Most of the groups we have, they pay for it. You guys obviously in a nice position where it isn't paid for, and just the overall convenience of not having to, take time off of work and call in sick to go take care of something that perhaps may only take, a few minutes to handle. It saves you obviously a lot of time and energy to not have to go to a doctor and basically go through all the travel time and just the overall issues with all that. So super convenient. There are 3 ways in which you can access the care. So of course, calling is to me one of the easiest ways. Of course, you have a phone number, it's an 800 number. You essentially call, you speak to somebody, you tell them a little bit about what you have going on. They then set the appointment with the next available physician, and they call you back hopefully within that 6-minute time frame. Obviously, as time goes on throughout the year, as we get into a more winterish time where their sicknesses are a little more prevalent, you might have longer than the 6-minute wait time. But of course, that's certainly not a bad amount of time at 6 minutes or even 10 minutes to be able to wait for somebody to call you back. So of course you can go on our website. You'll be able to set up your accounts that way. You can kind of go through, they'll walk you through step by step. I would like to make it a consultation. They'll ask a little bit about your symptoms, and then you'll obviously then schedule a phone call back from the doctor. You can also schedule a video call if it's more convenient, or if you have something to show. So I've had, poison ivy in the past, and basically did a video call, showed him where it was on my leg. He's like, "Yep, that's poison ivy. Let me call in the ointment to the pharmacy," and it was done in 10 minutes. So just a great experience. Everybody that's used the program speaks very highly of it, just again because of the efficiency that it provides you, the time savings, and of course cost savings for you guys. And of course, there's a mobile app that is available that you guys can obviously download and set yourself up that way. That has definitely become the most popular way in order to utilize the service. But it's nice to have the multiple ways that you can seek care, whether depending on your situation. Some people don't want to deal with an app, so you just make a phone call and get the services that you need. So it just kind of gives you a lot of different options for access. And of course, the advantages, as mentioned, you're going to save money because you're not going to have to go to a doctor. So you'll save money on your copays or potentially your deductible. You'll obviously have the convenience of being in your own home. Perhaps you're at work, you can make a phone call on break to handle a certain situation, depending on what's going on. You can avoid taking time off that might be either PTO time or even unpaid leave. So that saves you guys money in terms of being able to continue working. Obviously helps the centers out, because I know the way that your way that you're operate is that you need certain teachers in the classroom at all times. So kind of helps the centers as well with absenteeism to allow you to remain in the working conditions without having to take 3-4 hours off to go make an appointment, see a doctor, and do all those things. So just overall good savings options just in the overall program for you guys as well. And so that is essentially the telehealth side of the program. There's also a mental health component as well. And so mental health, given this all that's gone on with COVID, obviously has been a huge topic in the news, and we've seen tremendous increases in demand for mental health therapy. And what ends up happening is there's really a very difficult process to actually seeing somebody that'll accept new patients for mental health. So our program has, just gone through the roof with popularity just because of the availability and the access to actual counselors and psychologists that can speak to you and give you the treatment that you might be looking for. And of course, typical sessions are running at about $150 an hour for seeing somebody for mental health counseling. So our program provides you with 10 visits per year, and that's for everybody in the anybody in the family. So 10 visits per family per year. So that's essentially what you're provided for these multitude of conditions or issues that you might be dealing with, whether it's addiction, bipolar, depression, eating disorders, parenting issues, marital issues, things of that nature that you would want to speak to somebody that you now have access to make an appointment. Typical appointment time is running at about 5 to 6 days to actually be able to meet with a counselor. But of course, that's far better than many, many months where you were trying to see somebody in person. So obviously, it is over the phone, but it is nice because you can then create a relationship with that person. You can then schedule additional appointments if you like that counselor or psychologist. So you do have those options as you go in the program. It's not like you have to start all over with somebody once you kind of started within your program with that particular counselor. So gives you a lot of flexibility to have your kids potentially or your spouse or whatever. You have those 10 visits for anybody in your family to use towards the mental health. So Grad, no copays for you guys. Everything is completely free up to those 10 visits. There is the option. So just a quick sidebar here, psychologist and psychiatrist. The difference is psychiatrists are able to prescribe medicine. Our program does not include psychiatrists. Psychiatrists are a much more expensive option. Although we do have the availability for you to meet with a psychiatrist if that's deemed necessary. That, of course, though, is a separate cost item outside of our $0 copay. Typically not something that's overly necessary within our programs, but it is available. And again, psychiatrists are even more booked up than psychologists. So the fact that we even have that as an available option for you is actually a pretty cool and pretty awesome benefit in and of itself. So of course, there's a lot of stigma potentially still around mental health, although it has become more and more popular and more accepted. There is still that stigma, and some people, may not want to go physically to an office and prefer the privacy of their own home. So that this program gives you that option to have that privacy, to stay in your home, have that conversation within your four walls, and not really feel like you're, doing something that maybe you're not comfortable doing outside of your house. So essentially what'll happen once this all, I guess, gets launched, and I'm assuming Jessica and Jen will go over the process of getting you guys signed up for our program. What you'll need to do is essentially you'll have to then register your account because we just need to get some additional information from you, essentially just to confirm some medical items. That's also when you're going to be able to add your family members to the program. So initially, we're just going to have your data, your information, and then you will need to register, which we'll send out emails to you once the program's up and running with next steps of how you register your account. Once you register, you're then free and clear to use all the services as needed. And again, no real issues there. There is also a prescription drug program attached to this that is available to you at no extra cost. And then there is also a medical bill negotiator as well. So in the event you have a situation where you're a cash payer and you want somebody to help negotiate a different cost potentially to the doctor, we have a service that can help that, provided the bill is over $500. So all included within this program. And again, once it gets launched, you'll get an email most likely from myself with those next steps on how you kind of get yourself going, get your families added, get you the prescription discount card and everything else you need to have the info and what you need to get this used. So with that, I can open this up to some questions. Of course, I'm available to anybody via phone call or email. So take that down so that if you do want to reach out, if you have any questions, You know, maybe I didn't cover something and you forgot. Happy to try to help any way that I can, whether it's, you know, questions related to this, the prescription plan, or whatever. So definitely a resource and available to you anytime you need me. Let me know if you have any questions.
It looks like there's one
Brandon,
in the,
there is, sorry, there's one in the chat. Somebody was asking if there was an individual subscription or if the program can do it for all of the teachers.
I believe it's, you guys have, what, you're gonna do 500 seats for any eligible teacher, or I guess whatever your protocol is to be eligible within the Anchorage municipality.
yeah,
So
I believe because it's an application where we're gathering the information and then we are asking for individual permission to share that information with you and or with United Way Health Navigators. I think each individual teacher would need to fill one out for themselves. Does that sound right to the rest of the team? I'm looking to the thread people and I can't see.
Yes, Jen.
Okay. Okay. Yeah.
Okay, thank you.
If you have other questions, just take yourself off mute or put it in the chat, and we are gonna have some time for questions at the end. So if you don't think of it before we move on, we will get to questions when we're finished too.
I guess I must have done a pretty good job then. No
I think
questions.
so. All right. We'll move on. If you have questions, go ahead and put them in the chat and we'll take time at the end to answer those. So let me share my screen again. Okay. I don't know why it's doing that. Okay. So now so those were the new opportunities that we just talked about, the training, the health navigator and the telehealth opportunities. And thank you, Brandon, for that. That was really comprehensive. I appreciate that. And now we're going to talk about some ongoing opportunities that you may not have heard about. So I'm going to turn it over to Chelsea, one of our professional development specialists, to talk about Pro Solutions and Thread tools.
Thanks, Jen.
Yeah.
So Pro Solutions training, I'm going to switch my screen here in just a minute, but I wanted to just talk about overview. Is a wonderful resource. It's a beautiful education training website that Thread has paid for people. And we have a subscription that you can send me an email for to join, and it's on the next slide here. But the cool thing about Pro Solutions is there's 200 hours of accredited training available. All of these, many classes are support your CDA training program. All the classes that are required to meet your 120 hours. So there's courses to complete and to maintain your credential too when you're renewing it, as you do every 3 years. And you can learn at your own pace. And Pro Solutions is SEED approved as well. It's a wonderful, wonderful tool. I've actually enjoyed taking the classes myself. Jen, could you skip to the next slide, please? There's only a few slots remaining and our subscriptions do expire January 15th. So I would encourage you to send me an email and get a login. And if you send me your email, you'll get sent a welcome email with your registration information on it. Then you too can come check out the Pro Solutions website. So my name is Chelsea, and you can find me under the staff link on the Thread website, because it's kind of a long last name to write down here, but it's C. Kohanovsky at threadalaska.org. Again, I'm the only Chelsea here so far. We have Kelsey's on the Thread website. Send me a message and I will send you a welcome email. I'm going to share my screen for a moment here. And I want this one. Okay, are we seeing the Pro Solutions website now? Okay, fantastic. So this is the Pro Solutions website. After you've logged in, this is the page you come to. There's resources here for educators with trainings You can choose your state, but so far all the trainings here in Pro Solutions are like a seat approved, as Cassie mentioned, and they're approved for Alaska use. So you don't actually need to choose your state here. I can show you where to go above. Your CDA training, there's a lot of information here. If you click into earn your CDA, about starting your training, your transcripts, links to, oh, there's a great video of just even the overview. I'm sure most of you already have yours. There's also information here for directors and teams at the end of the website. So right up here at the course catalog is where I like to go. And then underneath here, there's so many different topics. For instance, if you click on child growth and development here, some really interesting classes that I've taken just because they're interesting. Brain power, cognitive development in toddlers, fine motor activities for toddlers. There's great classes on how to have conversations with parents, tricky conversations, working with your administrators, ways to build relationships with families, engaging fathers in early learning. There's just a plethora of information here. They're really fun to take and it's interesting. So I would recommend sending me an email and I will get you connected to one of our free remaining logins here. I think I will talk about, I'm going to hand it back to Jessica to talk about our next tool. Or should I just talk about thread tools?
You are next with Thread Tools, Chelsea.
Yeah, I didn't know if you wanted to give an intro. So if we could pop back here to the PowerPoint.
Yep.
I can just tell you, so intro is, Pro Solutions, even those, if you're located outside of Anchorage, which I know you might have somebody, you can get a subscription to Pro Solutions. For Thread Tools, moving into something that's one per program, and those outside of Anchorage can also take advantage of this. So take it away, Chelsea.
Thanks for that, Jessica. Next slide here. Yep. So here's Thread Tools. It's our centralized resource platform, a shared resource platform. And it has quite a wide available a plethora of tools as well, things for administration, forms, and it says policy templates, not police templates. Sorry for the typo. Nutrition, health, and safety, training and professional development, classroom resources, family childcare toolkit, and there's so many more. And I will show you that website here in just a moment. Can we hit the next slide, please? Thank you. So here's the login page for Thread Tools. And as Jessica mentioned, this tool that we have is one per program. And so your site administrator will send and will register here, one per program, and then that can be shared within the program. So I will share my screen again. And okay. So here's threadalaska.org, the Thread website. Right up here under educators and programs, if you hover over that, this bubble pops out. And here at the bottom is Thread Tools. So you want to click on Thread Tools. And I'm logged in already, but here's where you would log in, that last page I showed you. We're highlighting managing difficult situations here, difficult conversations, but right underneath here is where it's going to show you the sort of 8 main topic areas. And down a little further, there's trending topics and notes that you may want to check into. This tool is fantastic because there's literally everything in here. I'm going to click on Family Childcare Toolkit and just give you an example. So right over here, there's classroom and activities. Maybe you're wondering, what are some things I can do with my classroom? There's assessment links, curriculum links in the overview, early literacy activities, alphabet cards here down at the bottom. Both Thread Tools and Pro Solutions are available for the most part in both English and Spanish. So that is a wonderful tool for us. Alphabet cards, you can download them and you can hang them up. There's classroom labels and tips. If we go back here, there are policies and things already written up, and I was spending some time here earlier today just so I could explain to you a few things. I found sample letters for your parent-teacher conferences. They're already written for you. There's already like a behavioral consultation with a family template written up. So policies and templates, hand washing policies are in here. Volunteer orientation checklist. This is a wonderful resource. I'd recommend everyone log into, get your director's admin login here and check it out, because there's a lot available to everybody. Both platforms are free. Pro Solutions and Thread Tools. Thread Tools again is one per site. Pro Solutions, there's one for everybody. And your transcripts will be easily able to be printed out and given to your director. So that will be or you can also email it to them also and get credit and let your director know what kind of progress that you're making. So I encourage you to send us an email for Pro Solutions or to check with your director for the Thread Tools login. Ladies?
Yeah, thanks, Chelsea. So just to add on to the Thread Tools, we, usually will get those back and you logged in, and once you make your request within about a week. So if you flood the inbox, just be patient, and there's also some great discounts on there available too. You can make, how at Michael's they say, teachers get a discount. Well, you all are teachers too, and you can make your teacher identification badges on there. So there's a nice template for that. And then I'll hand it off to Candace.
Yep, give me
Right.
1 second. I'm just having some technical difficulties, so it's just going to be a second.
No problem.
I went too
Oh,
far.
and actually, Marianne is coming in now. So
Oh.
I'll go ahead and get her set up as a co-host.
Okay, then we'll do Candace and then we'll go back to her. How about that?
Sounds great. All right. I am so excited to share Threads marketing efforts with you guys this evening. We have some fantastic resources for you to use. The first one that I'm going to talk about is Calm. So for Provider Appreciation Day this year, Thread purchased a 2-year subscription to Calm for all of Alaska's early childhood educators. This is a fantastic app. It's the #1 app for sleep, meditation, relaxation, and it's actually been called the world's happiest app. So I am going to go ahead and share my screen with you guys. Give me a second here. There we go. Okie dokie. Are you guys seeing the Calm screen? Yes, great. So you can access Calm on a computer, on a tablet, or your cell phone. I have this on my cell phone. It's really great. You can start your day by using this app with some movement. Down in the corner here, my internet's a little slow, but you can do walking, standing, sitting, laying down, or some music. You can also use this in the classroom for kids. I have 2 young boys, and I really, really love the sleep stories. Actually, Calm prompts me every night. I get a little notification on my phone at 8 p.m. and it says wind down is starting. And I pick up the app and we know we're getting ready for bed, and we lay down and we listen to sleep stories. So I apologize. My screen is it's not loading. I guess I'm having some internet issues, but typically you would have access to a bunch of sleep stories, lots of meditation, and it can benefit your whole family and also the children in your care. And the cool thing about this is that you can share it with 5 of your friends or coworkers or family members for free. So once you get the app installed, you can share it with 5 dependents or anyone you want, and they get the app for 2 years for free as well. And my lovely colleague Tracy is going to drop the link in the chat. And you guys can just click this link and it'll take you to our webpage. And our webpage will run you through all the instructions on how to download the app. And if you have any questions about it, you can just email me. So something else that I wanted to share with you, and hopefully my screen cooperates now, or my internet, should I say, is we also have launched a texting service, which is right at the bottom of our homepage. You can sign up right here. It's a super quick form. Looks like this. And what this will do is this is something new to Thread that we are implementing. And basically, you can keep up to date with all of our big news, get reminders for Learn and Grow cohort meetings, and a ton more. Like for the MOA grant that we just released, you would have got, if you're part of texting, you would have got a text saying, hey, there's a new opportunity, check this out. So highly encourage you guys to sign up with texting. It's just another way to stay informed and for us to keep in touch with you. So you will also notice that our website looks a bit different. Super exciting. We gave our website a big overhaul this year. And it should be easier for you to navigate. As the lovely Chelsea pointed out, you just go straight to educators and programs. And a lot of your tools for early educators are right here in this little box. To find Chelsea, where she was talking about her page, you just go to About. Oops. And then you're going to go to Staff. And let's hope my internet cooperates. There we go. And this is all of us. So we can go find Chelsea. This is me. So if you have any questions about marketing, you can just click Contact Candace, or you can call me. There's Cassie, who's also with us today. There's Jen, Chelsea. There's Chelsea. Chelsea needs a picture. So Chelsea's new. She's just joined us. We're very happy she's here. And we'll get her picture soon. So something else that I wanted to show you guys is on the main page, you will see all of the big news that we've just released. For example, the MOA health and wellness support for you guys. So right down at the bottom where it says, excuse me, news and announcements, you will see all of the big news. And this is where you're going to click. This is an easy way for you to find the MOA application, the new one that's just come out. So you're just going to click this. And it's going to take you to our blog that explains everything. And you will just go and click straight to apply. And this is the web page. If for some reason you find that anything is missing on the web page or something doesn't look correct, please just give me a shout, just give me a ring, and I'll chat with you and fix it. I am not sure if anybody has any questions. I know that your time is precious, so just let me know. No? Okay, great.
All right.
Thank you.
Thank you. Thanks a lot, Candace. I appreciate that. I'm going to talk a little bit more about, well, actually, Jessica's going to talk next. Sorry, I confused myself. We're going to have Marianne with the Small Business Development Center, because I heard she joined, talk about their services, and then we'll hop back down to some more Thread services before we wrap up. So let me just share my screen.
Okay, can you, everybody hear me all right?
We can. Thank you for joining, Marianne. I appreciate
Okay,
it.
thank you. Thank you for inviting me. So this will stop other screens. I'm gonna,
Are you going to share yours?
yeah,
Okay, go
can
for
I,
it.
okay,
Yep, I'm going to stop then.
let me see. Where did I put everything? Okay. No. Let me see. So, while I'm finding my screen, the Alaska Small Business Development Center provides advising. We also provide the workshops, and I'm assuming that some of you have already taken some of the workshop trainings, and let me see here. And I'm going to show you where, what that looks like. Okay. Boy, okay. Let me get rid of this. Okay. Now, are you able to see my screen now?
Yes.
Okay. Um,
Is it the browser?
Here we go. Sorry?
We see the browser.
Oh, you see the browser, you don't see, okay, let me fix this. It's a good thing I'm starting a few seconds early. Okay. Are you seeing, it should say, what are the 5 greatest challenges in starting a childcare business in Alaska?
Yes, we see that.
Okay, excellent. So, first of all, if you go to our website, you are gonna have some of you already been to the Alaska Small Business Development Center website.
I would just assume that we haven't.
Okay, well, first of all, on our website, you can see the suite of services if you click here. And that will show you the workshops that we have. And I'm not going to click on that tool because I'm going to also show you the thread channel, which is where you will all go to have access to free workshops that are available through the thread channel. But I did want to show you, once you have taken, or as you are taking the different trainings, please write down your questions. And then if you reach the point where you are interested in speaking with a business advisor, this is where you would go for that. And it's under Suite of Services. You can click on Advising Overview and scroll down. And if you are not a client, you can click here to get started. If you're already a client, you can sign in, or if you need to directly contact your advisor, you can click here. And to give you an idea of what of our advisors here, about us. Okay.
Mary Ann, I don't think we can see the same screen.
What screen you're
can
not
see
seeing?
The Word document. What are the 5 greatest challenges?
That's all you see?
Yes.
Okay. Okay. Now, do you see the expert advisors?
Yes.
Okay.
Thank you.
You're welcome. So what I was saying is, let me go back since you didn't see that. So advising overview is here. This is our main, this is our, here's our home screen. And if you click here, you'll see advising overview. And you'll be able to scroll down. And if you're not a client, you would click here. If you're already a client, you sign in here, and you can also click here to contact your advisor. And to just give you an idea of who these people actually are, we have advisors all across the state. This is Carlos Machuca. He's the Anchorage Center Director. So if your businesses are in Anchorage, then, or whichever community you're in, if you're in Anchorage, Fairbanks, Juneau, Kenai, Matsu, or our rural center covers the rural communities and villages that are outside of those other 6 or 5 areas: Anchorage, Fairbanks, Juneau, Kenai, and Matsu. So when you initially sign up to speak to an advisor, you have it's called a client intake questionnaire. And I'm going to show you what those questions are. Because getting acquainted with your business advisor happens even before you walk in the door. When you complete the client intake questionnaire, the business center director reads your responses. And from those responses, he or she determines which advisor to assign you to. And these are the actual client intake questions. And a couple of these are very important to the advisors. I mean, they're all important, but the advisors especially look at your answers to questions 7 and 8. So what is your goal for meeting with an advisor? And describe your business idea, including the product or service you will sell. And giving a detailed response to these types of questions is really helpful for getting your questions answered during your first meeting with a business advisor, which is typically about 30 minutes or an hour. It depends on the amount of time that you're interested in. But they'll read this intake questionnaire, and they'll start doing some probing and collecting information to share with you before you even schedule your meeting. And so I'm going to go, I won't read all of the questions, but I'll just kind of scroll through. So feel free to add more content and really think through answering these types of questions, and it'll really improve your first experience with your business advisor. And there are 30 questions. Whoops, I'm so sorry. So what type of funding are you looking for? How much cash do you have available to apply towards your business? And question number 30, is there anything else you would like us to know at this time? This is where you can let them know that you have been taking some of the workshops, and you might even just list which workshops you've completed. And if questions come up while you're taking some of the trainings, write those questions down and list them for the advisor so that they are able to help answer your immediate questions, as you are getting started with getting assistance from them. And so like I mentioned, each center's director will look over your client intake questionnaire. And in Anchorage, that would be Carlos. And then they will assign you to one of the business advisors that most closely fits your needs. Here's Misty. These are Anchorage. This is Dan. He's in Anchorage. This is Angie. Whoops, sorry. She's in Anchorage. And then Russ is in our Fairbanks Center. And Jade is also a business advisor in our Fairbanks Center. Currently, we have Ian, who is the director of the Rural Center, managing the Juneau office until we hire a new Juneau business advisor. Cliff is the director of the Kenai Peninsula Center in Soldotna. And we have a business advisor, Robert, in Homer. Kellyanne is in Seward. And in Matsu, we have Misty, who is also works out of the Anchorage Center right now. And Ian, like I mentioned, he is also managing the Juneau Center, but he is the Rural Program Director. And Ruth is also a business advisor for the Rural Center. And actually, currently, she is traveling to Diomede and Gamble and some other communities to do in-person trainings. Whoops. So I mentioned that you may have already seen the list of trainings that we have available for you on the channel, the Thread channel, and this is a list of those trainings. And so what that actually looks like when you go to the channel, this is what you will see. And there's starting a childcare business in Alaska, finance, whoops. These are all the different workshops for finance. And technology, basics of cybersecurity, legal. If you're thinking about starting a LLC, there's a hour-long training on that. Basics of web design, if you're thinking about developing a website for your business, and engaging with social media, advertising. So there's a host of classes that we've offered that can help get you started with your business and will probably incite questions that you might have if you were able to speak with a business advisor. And that's why I wanted to show you the questionnaire, the intake questionnaire, so that you're thinking about the types of responses that you would make. And the more detail, the better. There's definitely no foolish question. The only foolish question is the one that you don't ask that you really, really want to ask. So can you see how Alaska Small Business Development Center can assist individuals?
Yes.
Okay, thank you. So the business advisors can help you with planning your business, navigating regulations and licensing, financial planning and funding strategies, marketing your business, and community engagement. It's one thing to market, but it's also, finding those connections within the community to grow your business, and partnerships, even if it's informal partnerships. And then they can direct you to the workshops, trainings, and networking. And with all of this together, between the workshops and the support you have with the group that you're meeting with, other childcare operators, and having a business advisor who can guide you, all of those things together can strengthen your business and hopefully will make a success story that we can share. Okay, so let me share my screen.
Marianne, you may have mentioned this at the beginning and I missed it, but can you talk about the costs for those services that you just shared with us?
Oh, well, I haven't mentioned it because that was not at the top of my mind, because the business advisors, meeting with a business advisor is no cost. Not at any point of working with a business advisor do you pay any fee. And with the workshops, because we are offering these classes on the Thread channel, there's no cost for you to take any of these classes that are in the Thread channel. So all of these classes are for free for Thread clients. Now, if you go to visit our website, you will see that that there are fees for some of these classes, but it is free for you. So there is no cost for any of these services.
Great, thank you.
Yeah, thanks for asking that question.
Yeah.
So can you see my screen still? I'll show you. Like, for example, digital marketing trends is $35. Some of them are free, a lot of them are free, but you have basics of cybersecurity on your channel, and normally that's $35, and it's free for you all. Are
And
there
so
any
that
other
channel
questions?
is,
Yeah, go ahead.
so that channel is, I was just gonna say that channel is through February of
Yes.
2024.
Yes, correct. And like
So all
again,
those,
this is what the channel looks like. And like I mentioned, all of the classes that you have available for you. So, and I know I've said this maybe a couple of times already, but I really strongly recommend that as you are taking these different classes, the trainings, write your questions down. And when you're filling out your client intake questionnaire, if you decide that you do want to meet with a business advisor, write everything you can think of, and that will help the business advisor get to know you before you even walk in the door, and will be prepared to answer those questions that you have and refer you to other services that we have available to us. So for example, there's something called IBIS World, and it's a very expensive subscription, but when you meet with a business advisor, they can make the reports available to you. And I'll show you. Let's see if I can pull up the slide quickly here. I think this is, yes, IBIS World. So they have very lengthy reports. So you can learn all about statistics of different, I mean, for example, if you're putting a business plan together and you need some statistics to describe how your business relates to others in Alaska or others throughout the country, these IBIS reports can be really, really helpful, and you don't have to do any research. It's just ask your question to the business advisor and they can help you get these IBIS reports. Okay, so I'm going to stop sharing now. There you go.
Great. Thank you so much, Marianne. That was really great information. I appreciate it.
Thank you. A little glitchy there for a little bit, but
That's okay.
thank you.
That's the nature of the virtual world that we're
Yeah.
on. Yeah. So I'm going to go ahead and share my screen and turn it over to Jessica just to talk about some other thread services that are available to all programs, regardless of where they are in the state.
Thanks, Jen.
Yeah.
So just a reminder that we do training, and our training calendar is on our new website there that's been had a facelift, and all those trainings on our training calendar are free. We are starting to do some in-person training, and I've seen some of you guys out in person, so that's really exciting. We have one coming up here on in September, that's going to be really exciting. That's going to be here in person, and I recommend it, highly recommend it to you guys. We also do technical assistance and coaching and help with your business and strengthening your business and using all of these resources and helping you set goals in the direction that you want to go. We also have our quality initiatives coming soon for this fiscal year. We're going to have topic areas such as infant toddler, accreditation, new provider, and outdoor play. So those are going to be really exciting. And those quality initiatives are projects that we do to help you increase quality in that specific area. So for instance, you know, looking at an infant toddler quality of initiative, or QI for short, that is a project to improve the quality of your infant and toddler environment. So usually that's a project where you take some training, you receive some technical assistance and coaching and set some good goals, and then you usually receive some financial award as well. We also do CDA advising, and we provide CDA verification visits for those of you who are ready to have your verification visit completed. And then we also house Alaska Seed and Learn and Grow, which Jen will tell you about. Oh, Jen, you're muted.
Right. Yep. I'm muted. I'm sure that you have heard of Learn and Grow and Seed before, and we are lucky to have Cassie, our seed manager, here. So I will turn it over to her in just a second, but Learn and Grow is our quality recognition and improvement system that many of you may already be aware of or be participating in. But that is an opportunity that is available to you that will get you even more resources. And so that Learn and Grow is for programs, where Seed, our system for early education development, Alaska Seed, is for individual educators. And I will let Cassie talk about Seed.
Hello, hi, I'm Cassie Hulse. I know many of you, I've seen you over the years that I've been with Thread, and I've been with Alaska Seed just in the last year and a half or so. So Seed is our childcare early childhood registry for the state of Alaska. And as the registry, it's the framework for recognizing and advancing early educators and school age professionals within the field and recognizing that. And so this is the place that Seed Registry to join, where you can turn in your training and your education. And, you know, we would evaluate that on the career ladder based on what you turn in with us. And then that is a place where you're documenting your training, you're tracking your training, and help you plan for, you know, goals for yourself. Oh, I'm a seed level 3. What do I need to be a seed level 4? And you can skip levels depending on where you currently are and where you're headed with your education and training. And then being part of the Seed Registry there are benefits to that if you're also working in a licensed childcare program where we have reimbursements to help you get your training and advance on the career ladder, as well as, meeting your training requirement for licensing. And then being in the SEED registry is one of the requirements for participating in this municipality wellness that we've been discussing today. So that's a quick overview.
Yes, thank you, Cassie. Good point that most of our quality initiatives and opportunities require you to be an active and current in the SEED registry. And then I'll just talk about Learn and Grow. So if you are interested in learning more about Learn and Grow, you can contact us at Thread, and we can put you in contact with our Learn and Grow staff to give you more information on how you become enrolled, to show your commitment to quality and get supports and resources to meet increasing quality standards. So we've been talking a lot at you, which is not the best way to give out information. So I would love to hear from you if you have questions about anything that we presented tonight, specifically, really questions about anything, but especially if you have them about the new opportunities for Municipality of Anchorage programs. And I cannot see the chat, so if there are questions in the chat, let me know.
Absolutely, I've got the chat. Nothing right now.
Okay, I think it was Marianne that said there's no wrong question, it's just the one you don't ask. So if you're wondering it, somebody else is probably wondering too, so you can be the brave one to ask. I'll let it sit for a couple more seconds.
Maybe we were so thorough.
I know. All right. Well, if you have them, put them in the chat, and I'll just rely on Jessica or Tracy to let me know. And then, oh, go ahead, Tracy.
I'd love to know if we had more options for classes. I'd love to know if there are more options for classes.
Anything that's been confirmed would be on the training calendar.
Okay.
She
More
said
options.
actually, Adriana, that she loves to know that we have more options for classes.
Oh,
And
okay.
saying thank you for that.
Okay.
It is cool. There's trainings, but there's also all these on your own asynchronous training opportunities that are free once you register. So
Yes.
And
Great.
I also want to mention, there is the Thread channel that offers you classes that, some of them are free, some of them are not free, but they're all, like on our main website, but they are all free to you. But in addition to that, there are other classes that you can scroll along on our website, just click on workshops, and you'll find a long list of other types of trainings as well. Some of them are free, some of them are a fee.
Great. Thanks, Marianne. Well, good. I'm glad that people are finding that helpful.
Candace just popped in the chat to a direct link to the Thread training calendar.
Great. Thank you, Candace.
As well.
All right. Well, then hearing no more, I'm going to go on, but if you think of one, just put it in the chat and we'll try to get it answered. I was just going to give a brief summary of what we heard tonight. So here are some information on some of the resources that we talked about. This is a QR code that'll take you directly to the Small Business Development Center, our channel there. And then just reiterating Chelsea's email address, if you didn't get that, if you're interested in signing up for Pro Solutions. I'll leave that up there for a second. And then just want to kind of go over again, we have our current application open that Candace showed you how to find. There are some links I think that my team can put in the chat as well, but you can go to our website to fill out the current application for the wellness training, the telehealth services, and the health navigator. And then just generally on our website, not only will you find this application, but also you can get to Thread Tools and the Calm app as well from there. And if we still don't have any questions, then we might be able to do our evaluation and get out of here a little early in honor of wellness to go have a little bit more time in our night. So I'll turn it over to you, Jessica.
Thank you. So hearing no questions, I'm going to go ahead and stop the recording. Should be good. Because if you are watching the recording, you don't need to complete the evaluation. Thanks for watching the recording.